Psychological disorders. Learning objectives. First, to understand and evaluate the nature of psychological disorders. Second, to summarize and compile the criteria for psychological disorders. Third, to illustrate an in depth understanding of the term mental wellness, its various aspects, and demonstrate the understanding of mental wellness on a illness wellness continuum given by John Travis and interpret it in detail. To classify the various mental disorders and understand its symptom as per the DSM 5, and to understand the various symptoms for identifying and treating psychological disorders. First, introduction. In 11th standard, we have learnt about abnormal behavior. We also tried to understand what are the criteria for the abnormality. To sum up what we have already learnt, the major criteria that we discussed were deviance, personal distress, and impaired functioning. Now let us study the examples given below. Activity 1. On the basis of your understanding of various criteria for abnormality, which of this would you consider as normal or abnormal behavior? First, Hemant wears the same lucky blue shirt for all his major competitive exams. Second, Seema is not able to fall asleep easily. Third, Rakesh throws pillows and pounding fists on the wall during arguments if he finds himself losing ground. Fourth, Reena always experiences fear but is not able to specify what is so scary. Most of us will find it difficult to decide whether any of the above can be considered as normal or abnormal and find it difficult to classify on a clear cut basis. Why is it so? We will try to understand it in the next section. Nature of psychological disorders. We observed that distinguish normal behavior from abnormal is not very easy. This is because illness and absence of illness are not two different categories as we think. According to the mental health continuum model, they are two opposite poles of the same continuum sequence in which two adjacent points are not clearly different from each other. An individual can be on any point at one particular time, and we keep shifting our position on it as our situations improve or deteriorate. For convenience of better understanding, let us mark on this continuum 4 stages. Let us study this with the help of the following diagram. Stage 1, extremely healthy. Stage 2, moderately healthy. Stage 3, moderately unhealthy. And Stage 4, extremely unhealthy. This is the diagram of mental health continuum model. In Stage 1, these individuals are positive and are functioning well. They show stable mood, they are calm, peaceful, and satisfied with life. They feel motivated and energetic. They are physically as well as psychologically healthy. You might have experienced this during times when there is nothing to worry and you are overall contented. They are satisfied with their life. In Stage 2, these individuals are neutral but reactive. They do feel nervous and worried at times and get affected by the stressors of life. Sometimes they may doubt themselves, which will cause anxiety, and this can affect their performance. They may feel tired soon and may lack energy. You might have experienced this too. Say while facing the examination or at the time of interview. But in this stage, if the individuals becomes more realistic and accepts their limitations or constraints placed by the environment, they can manage to reduce the stress. At the same time, following a healthy diet and a healthy lifestyle with adequate rest and by engaging in more social activities, it is possible to push themselves back more towards positive healthy functioning. In Stage 3, When the individuals are at the point of stage 3, they show signs of psychological damage and they are moderately ill. They may experience negative feelings like sadness, fear, inadequacy, restlessness, or irritability. They may lack motivation to take up new challenges. Sometimes they feel overall apathy and feel tired even while completing their daily routine or work. Their relationships may get strained and they may even turn towards drug abuse or alcohol. Though they show clear signs of mental illness, they may still be productive and functioning properly, but may find difficult to do it. But this point is also not irreversible. By consciously trying to find the realistic root cause of the stress and with the help of emotional support, such individuals can fight with the moderate illness they are facing. They can get emotional support either from family and friends or at times they may need professional help. In stage 4, individuals show clear signs of major psychological disorder. They show extreme distress and impairment in all three areas of functioning, which is mental, emotional, and social. They need professional care and treatment. Criteria for psychological disorders. An individual keeps shifting from one stage to another depending on his/her life circumstances. In such situations, how do we decide what a particular person is suffering from any psychological disorder or not? The mental health professionals currently use diagnostic procedures to make such decisions. For this purpose, generally DSM and ICD criteria are currently used. According to the present DSM 5, there are 5 criteria for psychological disorders. Let us study them in detail.